So today's presenters. Today we've got several people. Bridget's telling me to pay attention here. First speaker is Lorraine Wickheiser. Lorraine is is here to do the overview of the long-term care hospital QRP and care data set, version 4. She's currently a nurse consultant at CMS, and she directs the coordination of the long-term care hospital QRP within the Division of Chronic and Post-Acute Care at CMS. She has extensive clinical and training experience and has worked as a trauma nurse, a patient advocate, and an intensive care cardiac care nurse, as well as working with dialysis patients in an interventional radiology center. Next up, we have Michelle Lapira, and Michelle will be presenting on Section A, as well as covering the long-term care hospital QRP resources presentation toward the end of the day. Michelle is a registered nurse, clinical coordinator, and case manager at the Hospital for Special Care in New Britain, Connecticut. Her background includes nursing leadership in the areas of clinical innovation, quality, and patient safety. In her current role, she's responsible for the oversight of nursing practice and clinical care at the long-term care hospital satellite facility in Connecticut, associated with her hospital. She's the 2018 recipient of the Nightingale Award for Excellence in Nursing. And you have all these bios in your packet. The next two are Ann Deitch and Carol Schwartz. Ann is an RN. She's a certified rehabilitation registered nurse, CRRN, and has a doctoral degree in epidemiology and community health. She's currently a senior public health analyst with RTI and is part of the team that is developing the continuity assessment and record evaluation tool, CARE data set. She has an appointment at the Rehab Institute of Chicago Center for Rehab Outcomes and Research, and is a research associate professor in the Department of Physical Medicine and Rehabilitation at Northwestern University, Feinberg School of Medicine. Carol Schwartz has worked at RTI for nearly 3 years. She's a public health analyst in quality measurement and health policy program lead within eHealth Quality and Analytic Division. And she has 20 years of combined professional, clinical, and research experience in acute and post-acute rehab. And we have 2 more to get through here. Next up is Terry Collard-Eng. She's also with RTI. She'll be presenting today on both sections I and O. She's a research public health analyst at RTI's Healthcare Quality and Outcomes program. She has more than 30 years of experience in acute care nursing and leadership roles. She started out her career in Boston. And prior to pursuing doctoral studies, Terry directed cardiovascular and medical nursing at Brigham and Women's Hospital. And among her many responsibilities, she served on interdisciplinary teams that developed and implemented innovative quality improvement initiatives aimed at improving patient safety and workflow. Next up, we have Joseph Cliff. He's a physician or a doctor, Dr. Cliff from CMS. He has a doctorate in education, an MPH, a master's in science, and a PMP. And Dr. Cliff is a health insurance specialist at CMS. He has more than 15 years of experience in public health. And one of the reasons he's here today is because of his experience with measures development. We have a lot of the clinical experts here and people who are used to using this data, coding this data. There's a whole science behind measure development, and Joseph is involved in that. He's the measures lead for the hospital acquired condition reduction program at CMS and supports the hospital inpatient quality reporting and outpatient quality reporting programs. And so that's the lineup today. And I'm going to jump into some general information. All the training materials that you have are located in your packet. Was that my 5-minute cue? I better get moving then. We have a couple of things I'm going to point out, and then I'm going to go to Slido. I don't know if you've ever used it, but Slido, if you'll go ahead and get your phones out while I'm starting to go through the final bit of this presentation, we had asked you to bring a phone so that we could do some polling, and all the presenters today are going to be doing some polling as they're going through. It's actually kind of a neat system, and we've been using it at Econometric for about the last year. And Ephraim in the back of the room is the expert and is going to be running this. And so if you'll go ahead and pull that up and type in slido.org in your browser, or slido.com, I'm sorry, and that'll pop up. And the first screen you'll see is one that just has a hash mark sign and then a blank. And you type in Econometric on that, and you're going to be able to get into this. And I'll give you just a second to start doing that. And I'll mention this is being videotaped. These videotapes will be available on the CMS website in about 4 to 6 weeks. And certificates of completion will be emailed to all the participants following the training. If you're having trouble hearing anything today at all, there's a table right over here that says reserved, and there's a screen right beside it that has closed captioning on it, so you can get over there and know what's going on. We do ask that you start typing in questions in Slido, and presenters will be able to go through and review those today at lunch. They're going to be meeting across the hallway. And they'll come back after lunch, and at the end of the day, we'll be able to answer all the questions we've got. There will be a little bit of time at the end of some of the sessions, so we'll be able to get to a couple of sessions there. But the main ones will be at the end of the day. All right, so now we're going to see if you were able to get into Slido. Is there anybody who's still having trouble with it? Good. And if you'll go into Slido, we've got a poll. The first one up there, this is just to try it out and get used to it. What popular street vendor food was invented in Baltimore? A, hot dogs, B, snow cones, popcorn, roasted peanuts. And as you put this in there, you can see that your responses are coming up on the screen. And I'll give people just a couple more. A few more are still entering. You can actually see up there at the top how many people have entered their answer so far. So it looks like snow cones, 50%, is the response that most people feel is correct. And we'll flip to the next slide. And snow cones is correct. Invented right here. And according to Bridget, either the late 1700s or the late 1800s. What school of healthcare was first established in Baltimore in 1840? Is it nursing, chiropractic, dentistry, or laser eye surgery? And we've got a tie between nursing and dentistry. Nope. Yep. I'm going to go to the answer. And the answer is dentistry. Next one. What vital public institution was first inaugurated in Baltimore in 1774? Is it the fire department, the movie theater, the ice cream parlor, the post office? I go to the answers, and it's the post office. Becoming less vital every day. The first successful manned blank was launched in the U.S. in Baltimore in 1784. And this is the last one. It looks like hot air balloon has it so far. Can you advance? Thank you. Hot air balloon. Okay, so there's one other function that we have on Slido that you're going to need to use today, and that's how to ask questions. If you go to Slido and you look up at the top of it, you can see one tab that says questions and the other tab says polls. And if you'll click on the little person that's up there in the top right first, we would like to get your name, company, and email if that's possible. That way, as you're putting in questions during the day, it'll log who's putting in the questions. And if we need clarification on any of those, we can go directly to you to get those. Have people got that set up? So as you get that set up, you can go down to the question. We've got some questions coming up there now. You'll be able to view those on the screen as Ephraim puts those up for you. And I'm going to jump to the last thing because I'm over time. This is the action plan, and just as a reminder, each of you has one of these in your packet with different page for each section of the long-term care QRP that we're working on today. And the intent of the action plan is to provide you with an opportunity to jot down some action items that you have as you're going through today, because this will really sink in. Bridget, what are you having them do? Okay. Is anybody still having problems getting the profile in there? Some were going ahead and doing it because they were popping up on the screen. So go through and use this action plan as you're going through today. Write this stuff down. Make plans to start using it as soon as you get back. Maybe we can contact a few of you and see if you're making progress on your action plan when you get back. The last thing I'm going to tell you before I introduce the first presenter. Can we go ahead and pull up her slides? Is that the restrooms are back here to the left. The room where they're going to ask you questions is right over here to the right. And with that, could I ask our first presenter to come on up?